helpful?
Yeah.
So that goes really for any men or women. If you're really anxious and you find that alcohol really helps you feel better, okay? The way that, or if you're like Xanax or Valium or anything like that, all of those benzodiazepines, then look for a supplement, work with someone that can help you raise your levels of GABA. Okay? And sometimes you can take GABA and it'll work just like that. Other times, taking the GABA doesn't work, and you have to take the ingredients that indirectly help to raise your GABA. Okay? You just have to figure out what's going to work the best for you. Glycine also works very nicely. Taurine also works sometimes. All of those are very, very calming neurochemicals. Magnesium works really nicely to calm you down. And what it does, it's a little bit different. It doesn't raise your GABA per se. It blocks, everyone knows MSG, monosodium glutamate. Okay, well we have lots of glutamate. I mean, one of the most plentiful amino acids in our brain is glutamate. It's a very stimulating amino acid. It's a stimulating neurotransmitter. But if you have too much of it, you're anxious. You're anxious. And your brain is getting fried. Okay? And that's what happens when you go to have the Chinese restaurant syndrome and you get the MSG, because that's a chemicalized form of the glutamate. What magnesium does is it blocks that receptor. So the glutamate doesn't constantly overstimulate that receptor in your brain. That's what the magnesium does. So that's why people say, oh, I feel so calm. That's what it's doing. Okay. If you have little bumps in the back of your arms, you're probably either vitamin A deficient or evening primrose oil deficient. If you're vitamin A and vitamin D deficient, you're hypothyroid, even if your thyroid hormones are normal. You have to have vitamin D and vitamin A in order for your thyroid hormones to reach the target and for them to be effective. Is that helpful?
Mm-hmm.
Okay. You also need to be on some iodine. Okay. You can use kelp. If you get like the Celtic sea salt, and you take out about a third of it, and you get some kelp, you can stir it up, and that's about the right ratio that's palatable. Okay. I put people on iodine capsules that have iodine and iodide in them. Why are there so many more hypothyroid women than men, huh? Huh? Why don't you see lots of guys who are hypothyroid? Because we have boobs. Really? That's it. Breast tissue is very, very, very similar to thyroid tissue. So women use a lot of iodine in our breasts. Men use a little bit in their prostates, but prostates are the size of walnuts, you know. Okay. So the larger your breasts, the more iodine you need. And I will have women paint their breasts with iodine if they have like fibrocystic breast disease, and they get rid of it. Or if they have painful breasts, paint your breast with iodine.
That has to be in Lugol's.
It has to be Lugol solution, which you can get sometimes in the pharmacy. You might have to ask your doctor for a prescription for it. This is not betadine, folks. And Lugol's has both the iodine and the iodide in it. But you need some iodine. Even if you don't have a thyroid, you still need iodine. Yeah. If lymph does not flow in your body, okay, unless you have iodine. So you have to have iodine for lymph to flow. How do you get toxins out of your breasts? How do you get toxins out of any cell in your body? It comes out through the lymphatic system. Okay? So you have to have iodine. All right. Okay. Being on hormones will help your bones. All right. Being on some testosterone, some progesterone, and estrogen will help you preserve your bones. All right. If you have bone loss, even on those hormones, or if for whatever combination of reasons you're not going to be on those hormones, then the critically important nutrients for you to take, okay, are going to be a good calcium. All right, now, you do not need 1,000 milligrams, 1,200 milligrams, 1,500 milligrams, like the radiologists used to say on the DEXA reports. All right, they used to push high doses of calcium. They're not doing that anymore. They've removed those recommendations for calcium. Why'd they do that? They did it because 3 or 4 studies of large numbers of women now have said, if you take calcium to strengthen your bones, does it work? Well, yeah, it works. If you have 1,000 women who take supplemental calcium and 1,000 women that do not take supplemental calcium, you have 3 fewer hip fractures among the women who take the calcium. That's not a whole lot, is it? That's a lot of women taking calcium without reducing their risk of hip fractures. Oh, and there's 6 more heart attacks among those women who are taking calcium. So what's going on there? They're small numbers, but when you expand them to millions of women, hundreds of millions of women, that's going to affect a lot of women. So what they found was that if you take high doses of calcium, you're going to increase your risk of having heart attacks. They found it in Japan. Women who live on the eastern side of Japan eat one kind of breakfast meal, and they have strong bones and lower risk of heart attacks. Women on the western side near Hiroshima, they don't eat that same meal, and they have an increased risk of heart attacks and softer and weaker bones also. So there's a connection between where's the calcium that you're taking going in your body, and we need enough calcium, but we don't need too much. So a very smart woman who happens to be a naturopathic physician up in Canada wrote a book called Vitamin K2 and the Calcium Paradox. And she has researched the literature, and I came very late to this. Dr. Mercola is all over this for people who go to his website. But what you need is you need some calcium in your diet. You don't need 1,500 milligrams, 1,200, 1,000 milligrams. You probably need somewhere between 400 and 600 milligrams in a supplement. All right? And what vitamin D does for you is, here's the calcium in your gut. Vitamin D helps you get that calcium out of your gut into your bloodstream. So calcium's here. Now, if you have adequate amounts of vitamin K2, what happens is vitamin K2 grabs a hold of that calcium. Calcium's movement in the body is very tightly controlled. So it grabs that and it chaperones that calcium to where it's supposed to go, which is over to bone or muscle. Those are the 2 main places that calcium goes in your body. Takes it over to bone, hands it off to boron, and I'll come back and tell you what boron does with calcium in just a minute. And I had no problems with that. That made sense to me. Now, this woman also, though, said that there's a second kind of protein that is activated by vitamin K2. And it goes out and it does a search and rescue mission on all of this calcium that's gone to the wrong place. So what happens as we get older? We get harder. We get stiffer. We get hardening of the arteries. We get calcification of our heart valves. We get calcification lining the carotid arteries. We get calcification of our cholesterol plaques. Everything gets harder and stiffer. Okay? If you have enough vitamin K2, you're not going to harden as fast. You're not going to calcify soft tissues as quickly. So we need vitamin K2. No, guess what it's in? It's in dairy products. It's in cheese. It's in eggs. It's in butter. It's in, I said eggs. It's in cream. Hard. Well, no, it's not. You're cute. It's in the dairy case, but no, it did not come out of a cow. It came out of a chicken. It is also in liver pate. It's in fat. That's where it is. But it's in fat from cows and from chickens that eat grass. So it's originally in grass. Now, is most of our butter and cheese and eggs grown that way in this country? No. Does our government say, eat butter every day, eat cheese every day? Instead of, no. Our government says, that's bad stuff for you. It's going to raise your cholesterol. You can't eat that. Okay, it's gonna cause heart attacks. Well, actually, eating healthy cheese, eating healthy butter, eating healthy eggs from animals that have been grown on grass, okay, will lower your risk of heart disease. Ah! Could that explain the French paradox? They eat the liver pate, they eat the cheese, they eat the butter, they eat the eggs. They have a lower risk of heart disease than we do. I don't think it's the resveratrol at all. I don't think it's the wine. I mean, they have found that it takes, what, is it 200 micrograms or 200 milligrams of resveratrol to really have a, I can't remember the
200 milligrams.
milligrams. I mean, it takes, what is it, 5 bottles of wine a day to get enough resveratrol? Seriously. And there's just not enough, there's not enough resveratrol in the wine to make a difference. It's got to be something else. Over in Japan, they make a cheese from fermented soybeans called natto. And it tastes like a very slimy blue cheese. And the breakfast meal on the eastern side of Japan, where the women don't have heart attacks and they have strong bones, is some rice, a big blob of natto cheese, a raw egg, and cut up green onions on top of it. So they have some of that vitamin K2 every single day. Okay? Now so that's K2. Now, what's the name of the Irish cheese? And Irish
Kerrygold?
Kerrygold. So Kerrygold, if you buy the Irish butter, Kerrygold,
Or their cheeses.
or their cheeses, guess what? It is illegal in the EU to feed cattle grains. So they're just going to be grass-fed. Catherine's the one who brought this up. I've come to say, I always used to say you have to have organic butter, because PCBs and dioxins concentrate in butter. And so that's how we measure how toxic is the world with respect to PCBs and dioxins. And if you get organic butter, then it's not going to be as bad. Well, Catherine pointed out, Vaughan, grass is organic. Ah, yeah. And then you get the right proportion of fats. You get that healthy proportion of fats. And if any of you remember eating wonderful butter when you were a little girl or a little boy, and the butter was wonderful, if you get the Kerrygold butter, it tastes wonderful. And some of it has to be because of the K2. Now, I am not saying go home and eat a stick a day. But I'm saying if you were going to eat some butter, why not have butter that's nutritious and healthy for you, as opposed to our manufactured butter in this country?